Hello, everyone. It's time for our August update. So, looking forward to sharing a lot of really good things with y'all. So, we've got continued success with a lot of the initiatives that we're trying. So, start off and kick it off with just thanking everybody in the organization. We've had low census, we've had the ORs, we had the flood on Third. I mean, we have absolutely, as a team, went through the gauntlet, but we're going to come out on the other side in a much better place. So we're a strong team, we're resilient, and I know that we're going to be able to learn from these opportunities, and it's just going to make us as a team and an organization even better. So thank you for all your support. So just to kind of go over the topics for today. So we're back to break even. We'll talk about the 3 KPIs organizationally that we're trying to drive and the progress in that. I want to give you a little update on kind of how we continue every single month. We are continuing to really integrate ourselves within the community, find out, hear the voice of the people that we're serving. Y'all are a great voice of that, but we also want to extend past, our own hospital family. Operational update, and then some of the successes we've had, and then again talk about some recruitment initiatives that we're kind of moving forward. I'm still quite feeling quite blessed related to the amount of providers that we've been able to continue kind of connect with, and us to attempt to recruit and see, is our organization a match for what they want to do, right? That's really important. If we have individuals that come here for the wrong reasons, right? That's not going to fit into our culture that all of us are really driving and striving really hard to make happen. So back to profitability. So when we look at that, we're, as far as we talked about before last month, that we had about 500,000 a month that we still needed to kind of get in line, either with growth or figuring out a way to save on the spending side. And so I'm pleased to really talk about July. July was almost 300,000. So that's really probably our first full month that all of us collectively have been figuring out and working on the initiatives that we've kind of looked at that are helping feed this. And so we're almost over halfway there, really, the first month. So I'm super thrilled with that. We're making some amazing progress. When we think about days cash on hand, remember we've talked about we need to have 100. That's kind of the threshold for us to start rebuilding our credit. And that is important, not necessarily for us to purchase stuff, but many companies and vendors won't even do business with us, whether it's consignment or if we have a new vendor and we have poor credit, right? They're worried about us being able to pay them for the service that they're providing. And so, a credit is not just about us financing something. It's a lot more than that. It impacts our interest rates. And so, when we think about the things that we currently have, can we replace them with lower interest rates as we end up increasing our credit? That will really put that, right? And so if we can pay less in interest, that's more money, right? We can feed to that 500,000 a month, right? And so it's a lot of things from a multi-pronged perspective that we're truly trying to accomplish. On the community side, we met with, I had the town hall with Ken Miyagashima. He's one of the candidates for governor. We had some great opportunities, kind of a small, intimate group. We had providers there. We had some community members there. I was there. And we really got to talk about some of our real issues. As we look at this next election that's going to come in November, right, it's important for those candidates to understand what, from the grassroots perspective, right, us out here doing the work, what actually is the needs of the community. And so one of our big issues is malpractice. Our malpractice insurance, because of the legal system and the way that it's set up in New Mexico with no caps on punitive damages, that has a big impact and cost because of the actual settlements that are coming out across the state. And so that's a big deal for us. If we don't have the ability to be able to afford malpractice insurance, we have to have that in order to keep the doors open. The other thing I think I'd shared before previously was related to some of the Medicaid changes. For us in our area, When we look at the population that we are kind of have a little bit of a cushion, I guess, in perspective. And so the work requirements for the new Medicaid rules don't apply to the Native population. And that's a large portion. It'll apply to the rest of the population that's non-Native, but it definitely, it makes a smaller bucket, right, of opportunity for us, of ones that could potentially maybe lose their Medicaid insurance, which would then, of course, have them go uninsured. We're going to be putting a lot of strategies in this next year in 26 for us to help our community and those patients stay enrolled. And so some of it really is a process that we probably need to help shepherd, and other things may be us kind of coaching and mentoring them as well. But we want to try to keep, as many of our patients in this community, right, that can stay insured so they can actually get care that they need. A lot of times when people know they don't have insurance, what they tend to do is they pull back, right? They wait till they're really sick before they're coming into our ED. And then we have a hard time, right, getting them back to their best level of health. And so we want to make sure that we're preserving those things so we can keep our community healthy. Jeff and David presented at UNM related to, they covered actually malpractice and the cost, but they also just talked about a lot of the things that are happening within our hospital and the initiatives and things that we're putting forward. Marianne and myself met with Brian Lee, and he's a staff director for Senator Lujan. And so we, again, got to talk about medical malpractice, and we're really trying to make sure that we're permeating that message out. Following up with Dr. McCamey, and I'm quite excited. She's got a new breast surgeon that she hired for the cancer center. And so that individual, she is actually going to now probably do at least 4 days a month here in Gallup and at our hospital. And so now that we have the new 3D mammo, which we're super excited about, we are now going to be able to actually do biopsies, some breast surgery, the things that we did not have the ability to do. And you as our employees that are, needing those services at time, as well the rest of the community, we're having to then travel outside. And most of that probably was happening all the way out to Albuquerque. And so we want to preserve that, right? We want to have care done locally. And so we are really continuing to look at how wide we can get with that and how we can continue to increase our services so people will be able to stay in their place where they live. Snapshot of the KPIs. So I'll give you, so just a reminder, one was our swing beds, our actual census, and we want to grow that volume. We know there's a need in the community, and it is, one, it's a positive thing for our patients because I think we do an excellent job with those patients. And two, it's a great revenue stream for us. The second one was for us to look at our AR days, and it's accounts receivable. And that is the days that it takes us between when the patient is discharged to when we actually can send the bill out the door to the payer, right? And so we want to squeeze that time. Our goal is to get less than 45. That's our first goal. Best practice is less than 30. We can do that. We're just going to take it in steps. So right now we're at 68. And so we have a ways to go with that, but I promise you the teams are working really diligently, and we're looking at all these places because part of our things, if we think about a bill getting out the door, it's closing charts, getting orders signed off, all of us doing our documentation that's in the clinical perspective that's tied to that patient. And so our charges put in, all those things need to happen in as much real time as we can or very shortly after discharge, because every one of those creates delays. And then it makes us not have the ability to send that bill out. And so we're kind of sitting on that money and not getting paid. The second thing, or the third thing, I guess, if you will, would be our clinic appointments. When we started looking at that, we had about a 25% gap, meaning that we had appointments that were just going unfilled every single day. In our rural health clinic, it's about $300 per visit is what we get paid totally. And so that's a big impact to us. And especially we've been pushing it really, really hard. And that team has done a fantastic job of really increasing the appointments and increasing that revenue. And for this month, especially, as well as July, we don't have surgeries, right? That surgical volume, which drives a lot of our revenue, is not coming in. And so we're not going to have the ORs open back up until probably the 17th, 18th of September. So we're 2.5 weeks away from that, which is huge. But having that extra revenue and maximizing those appointments, those physicians are already there, the staff are already there. We just need to get the patients in the slot. Those teams have done a really good job. Our first goal is to be at 90% full, and we have hit that twice now. And so I just can't say enough about that. On the swing bed side, our census has been low overall. And so our swing bed census has been about 1.5 on average for the month. We are working diligently, and there's a campaign for us to really go around to all of our local hospitals that do not have the ability to actually have a swing bed program, that we're about 50% of that being kind of cast out and actually having communication with those hospitals. We'll have to work and continue to refine our process, right? We're typically not an organization that gets a ton of transfers. Usually we're transferring out. In this case, we're going to be receiving. And so there's a whole process from our side, as well as making it easier on the senders, right? If people don't have a smooth path for them to be able to transfer, they will choose a different path that's easier, right? It's a path of least resistance. And so super excited that we're starting to get that out. And I know that that's going to start continuing to build for us. Kind of where I'm on, as far as opportunities for us, give you a little kind of snapshot on the OR. So when the OR is complete, from that flood, we've passed all the inspections, air, etc. So I'm thrilled with that. They're currently putting flooring down. It's going to look beautiful. The nice thing is our whole entire OR is going to look like new. So that is really exciting for the team and the proceduralists. And so we are, again, like I had said, we're probably on the 17th, 18th of September is probably when we're going to open that back up. When we think about the areas in radiology or second floor and the sleep lab space, as well as that patient room that's on third floor, which is where that second flood took place, it's over the next 3 to 4 weeks. There'll be different areas that will start to open as they finish kind of the remediation in those spaces. The good thing is, right, those were partial. The OR, it affected the whole entire OR. And so that was really a big challenge for us. But, the team has responded beautifully, as well as some of our surgeons. We kind of ramped up really quickly on the second floor for us to do the procedure rooms, which are the old labor and delivery suites. And we're now doing endoscopy in there, and we're going to continue to add other procedures. And so I really want to compliment those teams for fastly, rapidly kind of figuring out how to make that work. We were planning on that, but we had months to plan. We didn't know we were going to try to do it in 3 weeks. And so we've had some great success with that. That also helps us financially because it brings procedures in, right? We were doing those procedures in the OR, and so now we can actually at least do endoscopies. And so huge kudos to the team. So I want to give you a little bit of successes to date when we think about our key performance indicators across the organization, right? Every department that y'all are in is measuring certain indicators. And so a few of them that have actually hit the goal, door to doc and door to triage in the ED, both are at goal, which is excellent. DNFC and DNFB, and what that means, discharge not final coded and discharge not final billed. Both of those are at goal. And so that is a part of that AR, that accounts receivable process, that is helping us kind of continue to bring that down, right? And so that is one piece of the cog. When we think about medical revenue in the clinics, part of that, it's above budget. And one of the reasons is because we're filling those slots. And so huge win for us. I already talked about the 87 days cash on hand. We talked about the procedure rooms that actually opened on August 25th that I did not share with you. And so it's been open since then. When we also look at kind of how we manage resources across the organization, we really are looking to have the right people at the right place at the right time with the right skill level. And so that It's an evolution, right? It's an organic process. So it takes time for us to all get kind of in the groove and figuring that stuff out. And so I want to thank y'all for your patience related to that. Also, too, some good news to share, and I haven't shared this before, is we're going to actually have a SANE program that's going to be out of our hospital that will actually support GIMC as well as ours. That we're getting that leased contract to actually be, it has to be executed with us and the county since they own the building and we lease the building from them. But it's going to be half of the ICU. So we'll have people here that'll be on site, plus we'll also have exam rooms for those patients. Right now, it's not a formalized place, right? And so in our area, we want to take that with a high level of consideration and scrutiny, that we are trying to make it private, make it quiet, give them a place where they can share and get the care they need, knowing that they went through a very traumatic experience, and we need to do our part in really kind of enveloping them, right? That they feel comfortable. So that ICU is actually a great place, right? There's no traffic over there. They can come up and then go straight to the ICU. And so I think that's going to be a huge success for us. So as we get the actual dates when they're going to move in, I'll kind of continue to keep everybody updated in that. So kind of opportunities for us to still improve. When we think about denials for us, we've got kind of 3 areas that kind of seem to be at the top of the list all the time. Making sure we have the right revenue codes, missing modifiers related to documentation, and then the HICPICs, which are also related to CPTs. And so a lot of that is driven from all of our documentation. Any clinician that is documenting in the system, coders have the ability to pick those things up. And so we have to make sure those things are complete. A great example is that when we look at infusion times, we have to have a start and a stop. And sometimes we're good about doing the start, we're not so good about doing the stop. Without that timeline defined, it negatively impacts our ability to bill for that, because it's unended, right? We have a start, we don't have a stop. And so there's no way to calculate that. Talked about the AR days coming down to 68. We have a bit with a charge lag. And that was the one thing I want to encourage everybody related to get your charges in. We went up to 26 days. So that if you think about that 68 days, right, we got to get to 45 as our first goal. If it takes us 26 days to get our charges in, we're making it very difficult for us to get that bill out. And so we need to work on that. Our overall turnover is 26%, went up a little bit, but we're still well below the national average, but we're keeping our eye on that. Bad debt is at 9%. We want to get it to 2%. And so that goes back to what I was talking about previously related to people being uninsured, right? If we don't help our community follow the new rules and keep them insured, that bad debt number is going to go up, right? And so we want to mitigate that. And so it'll be a partnership between the hospital and the community in order for us to try to figure that stuff out. Last thing is physician recruitment. And so we've got one exciting thing. We kind of partnered with a company, Vital Solutions, for them to help us recruit cardiologists and have them be here full-time on site doing clinic, hospital rounds, as well as supporting our ED from an admission standpoint. They told us we were going to probably have a 6 to 9 month time frame before they were able to actually recruit some cardiologists. Well, 2 days after we signed with them, we had our first interview with a cardiologist. He is actually coming on site this Thursday. So super excited about that. And we also have a second cardiologist that we just interviewed yesterday. And so we are going to work to get him on site as well. So we potentially, could have it land at least one of these and have that happen in the first month, which is amazing. That will have a big impact on census because one of our biggest transfers out of our ED and has been consistently is cardiology. And so if we have that support, right, and that specialist here, we can keep those patients here in Gallup and have people not have to be transferred. A couple of MAs. Dr. Khan is the family practitioner that will hopefully try to get him where he can come. Hopefully we got a contract to him, and what we want to do is actually kind of figure out the start date, and it's probably going to be at least November. And then we hired Helen, who is a family practice nurse practitioner. And so that is going to be exciting to add that. That's an area probably we'll continue to recruit for. I don't know that we'll ever not recruit for family practice, because I don't know that we ever will have enough, right? There's just such a big need for primary care. So that is all I have for today. I thank you again for all the work you're doing, and be really excited about all the things that are coming. There's some really great things. You should be proud of the work you do every day. Thank you. Have a good day.